I've already introduced myself. I'm really just privileged to introduce Kathy Karatasas, who's presenting today. Kathy has qualifications in social work and management and worked across direct service delivery and management services. She co-founded the Settlement Ethnicity, Language and Faith model, referred to as SELF, providing guidance on how to ask questions about culture to better understand its relevance for families. She's also the founder of Cultural Works Consultancy as well. So we're really pleased to have Kathy here today. Kathy, do you want to introduce yourself briefly as well? I know I've given a little bit of an overview, but is there anything you want to say about yourself before we start?
No, thanks, James. It was lovely to meet Emma last year when I did a Churchill Fellowship and a number of other colleagues. So it's lovely to be back working with Karam and sharing some of the learnings from the Churchill Fellowship. And I'm involved with one of the universities in New South Wales. We've been looking at some research over a number of years, very much focusing on children's cultural connections and upholding their right to cultural connections. And it's my privilege to be here having these conversations with you. What is my evening and your morning there?
Thank you, Kathy. Yes, no, we're really grateful for you joining us at this. What time is it where you are, Kathy?
So I think we're 11 hours ahead of you. Yeah. Wow. So it's a wee while. No, it's very good. It's fine. It's good.
Brilliant. Well, thank you so much for being here with us. And just we're really privileged to have you with us and continue the conversation that we've been having with you, with Cor and Bath, and just how important identity and understanding children's identity and their cultural needs and understanding how to have those conversations is just so important to practice. And so we're really fortunate to have this discussion today. But we also know that practitioners need help and support in how to do that, how to feel confident in asking about that, how to ask about that in a respectful way, and ask about that in a way which reflects their innate social work curiosity as well, and actually is about supporting the children involved. So we're just really grateful to have you here today to help us with this today. So I'm really fascinated to listen more. There we go. So question should hopefully come up on your smartphone. So the question is, how recently have you discussed culture in your team? Wonderful. So quite a few have discussed quite recently. So the vast majority very recently, an active topic. Some a little while ago. 8 quite a while ago, not a regular discussion. And 4, I can't recall having a conversation about culture. So it's a real difference in views there, but the majority are talking about it very recently. That may reflect our audience who are coming here today, who are interested in this naturally, who've come to a webinar about culture. So this is the next question. All right, it's on my phone as well. Individually, how confident do you feel about having conversations about culture within your team or organization? Ooh. So there's a bit more of a mix. So conversations are happening very regularly in some teams. Most people feel confident or somewhat confident, but they're still slightly confident and not at all confident. So even though there's lots of conversations happening about culture, only 14 feel very confident about having those conversations. That's interesting. Thank you. And this is the final question. Do you know where to find further information and guidance about cultures, faiths, languages, and ethnicities? It's really interesting to see the feedback. So thank you for everyone who's putting the feedback in. So some prefer not to say, no, I'm not aware of any resources. 6 people, 7. I've heard of a few, but wouldn't know where to start. 7. Most people say they've got a general idea where to look. And then 5 have got, I know exactly where to find the information. So you've got some people who really feel they know that they know exactly where to go to find the resources that they need.
Okay. As I said, thank you very much, James and Liam, for that lovely introduction, and it is lovely to be here. I'm a social worker by background, and for many years I've been working with children and families in foster care and out-of-home care, and advocating for children from multicultural background or culturally and linguistically diverse backgrounds. What we call in Australia is something that I have developed a strong interest in and an advocacy, particularly over the last 20 years. And what I want to share with you today is some of the research that I have been involved in New South Wales, in Australia, through a national research, through a Churchill Fellowship that I did last year, through and research that I'm undertaking at the moment, looking at the organisational lens that can facilitate and support practitioners to be culturally responsive, and to share how we developed the self-cultural framework, which essentially was on the back of working in and leading a multicultural foster care program in New South Wales, Australia, the first of its kind, where we had taken on the responsibility to match children from culturally diverse backgrounds with foster carers. And we thought we were doing the right thing, but we were asking all these questions around who and what were we actually matching? And that's where the self-cultural framework was designed. And so I'll talk about that. What we do, one of the things that we do in Australia that I don't think you do is consistently in the UK, when we start speaking and sharing any knowledge or any meetings, is we do an acknowledgement to country. And I'm just mentioning that to you because we've realised that Australia's communities over the last 200 years is on the back of colonisation and the changes that have contributed to many First Nations people in Australia as a result of policies that included removing children from their families. And there's a whole lot of intergenerational traumas and consequences of that, on top of working with children in out-of-home care. There's large numbers of Indigenous children in care. And we acknowledge that that's what our history is, and we want to do better and acknowledge that all the work that we need to keep doing, we need to acknowledge that the Australian Indigenous First Nations people of 65,000 years of culture is important to recognise and respect. So that's something that's unique in terms of the Australian culture, but it does reflect the value and the respect to cultures, and particularly the longest culture of Indigenous people. So I wanted to explore, why are we struggling to understand and respond to children's cultural rights? We know it's one of the rights, it's in the conventions of the United Nations, that upholding children's cultural rights so that they are safe and they're connected to family, community, and their culture is one of those United Nations rights that we have accepted is an important part of children's care. We know that cultural connections is such an important influence and an important life outcome. Yet, for many children from culturally and linguistically diverse backgrounds, particularly in Australia's community and from our First Nations, we're not doing that well. So we need to ask the question, why is that not the case? I think one of the reasons we're not doing it is because we constantly seem to be prioritising a whole range of other care needs that are important in presenting themselves in children's care. We look at placement stability, we look at relationships, we look at finding long-term care, we address health and educational needs, yet the cultural care needs of children often gets deprioritized in the context of so many competing priorities. The other issue I think that comes up, and that's coming up in a lot of my work and findings, is how do we actually identify children's cultures? while I talk about First Nations children in Australia, and while we talk about this language of culturally and linguistically diverse backgrounds, which is an administrative term that's been used for many decades now to identify minority groups and ethnic minority groups and refugees, and calling out the importance of recognizing their cultures, the concept of culture is something that, from a language perspective and from a concept perspective, is varied. There isn't a shared terminology. We use the term culturally and linguistically diverse in Australia very uncomfortably because it also infers to an othering. In the UK, you have other terminology. In the States, there is other terminology in terms of racial minority groups or Black British minority groups. So the concept of culture is really quite diverse internationally and nationally. And we don't count culture in terms of key data that we collect for children when they're coming into care. So in the data that we keep in Australia, we might keep information around children's age and their genders and their family history. And we talk about cultures and identifying their ethnicity language, but it's not a mandatory requirement. And through the practice, we actually are not identifying, or we found that we weren't identifying children's cultures. So he asked the question, is it true that if we don't count it, does it then matter? Because when we talk about the children's cultures in our care, I'm not sure whether anyone can actually explain who are the children's profiles in our current care, whether it's in the UK or Australia, because I don't think that demographics of the breakdown, there might be some groups that we know more about, but we certainly don't know the details of children's cultures in a way that is meaningful and consistent and comprehensive. So as I said, terminology is very different, and I think universally we do keep very different terminology around who we are when we're talking around about children's cultures. So in Australia, in probably the last 10 years or so, there's been a number of pieces of work that is responding to focusing on children's cultural connections in care. It's been a request and a recommendation of reviews for many, many decades, but it's been an area that has lacked intentional research. The Pathways to Care study is a longitudinal out-of-home care study in New South Wales. The reports are available through the government's website, the Department of Community Services, and I'm happy to share that with you. But the Pathways to Care, the report, the 20th report, that in 1920 looked at a cohort of children who were from culturally and linguistically diverse backgrounds, and I'll talk about some of the findings from that research in a minute. The self-cultural framework is the framework, as James mentioned, that I designed with some colleagues after we reflected on this multicultural foster care program, and we were looking at 250 children at one point in time that represented 75 different ethnic groups and 15 different faith groups and 40 different languages. And we were thinking, are we actually matching these children with carers? And the challenge of being able to find carers who could address and match children's cultures. And SELF basically it's a prompt to explore settlement, the settlement journey, ethnicity, language, and faith. My Churchill Fellowship last year took me to the States, the UK and Norway, where I was curious to look at what practice tools people are using in their work with children and families. And the practices were inconsistent, but there was a whole range of really good prompts that people were raising that I reshaped into an A to Z practice prompt that's included in the presentation today. A national Australian research project that's just been finalised. It's been 3 years in the making, where we've researched policies and practices in Australia, and then we've interviewed children and carers, parents and practitioners, and a model is being designed to support cultural connections and upholding children's rights to cultural connections. And my research has just started looking at the organisational levers that can help practitioners, because I'm really mindful that a lot of practice tips and practice guides look at supporting practitioners do their work with children and families and being responsive to children's cultural connections. But there's something from my perspective that's also required in organisations to be able to support practitioners through teamwork and through training and through data and through other levers that organisational executives and organisational teams can contribute to. You right there, Liam? Yeah? Okay. Sorry, I saw your hand up, so I wasn't sure whether you were stopping. Okay. In terms of the pathways, so this is the Pathways to Care longitudinal study. In 1921, published the report that explored children who had come into care. It looked at their child protection reports as well as the out-of-home care reports, and it reported on the views primarily from carers. So it looked at the data that was available about children from multicultural background and carers' views. And some of the findings included 40% entered care, the out-of-home care system, below the age of 3. 55% had less child protection reports than other children who were not identified as multicultural. 55% went straight to foster placements, not kinship placements. And generally, children from multicultural backgrounds had similar developmental outcomes as their peers. So one of the questions around why is it that they're coming in to care at a younger age? Is that around our assumptions? Is it around physical care? What is it that that maybe practitioners were assuming that the circumstances of their care environment couldn't be changed, and that maybe that expectation was negotiated, or there was more communication with families where English was more fluent? It raises questions around cultural assumptions and potential biases of practitioners. Carers reported that children had little exposure to their birth language. So they generally spoke English, and their parents' birth language was not something that was prioritised. There was little access to cultural and religious activities. About a third did not identify with their cultural backgrounds. They identified with the carers. And they were less likely to have contact with both parents as well as siblings who were not living with them. So less contact with both parents and siblings. The things that were upheld or that were present in terms of the cultural practices, the identity was maintained. So the child's birth family's name was maintained, and cultural food seemed to be a cultural practice that carers said they were comfortable with. Storytelling and discussing their identity was something carers said that they were comfortable with and that children were interested in. Community and family, carers were happy to take children out to cultural events, to festivals, as ways of learning around their culture and sharing information around history. It was ad hoc, but this was something that carers generally felt more comfortable with. And maintaining both language and cultural practices was something that was suggested that they could do more of, but they weren't as comfortable. So the question is also around could these sort of practices help us explore more the information and reflect in terms of the way social workers and practitioners make assessments and judge and work with children when they're coming into care? If we're making it's asking us to reflect. I think it's given us a whole range of questions to be thinking about. How can we do these sort of things better? And so in 1919, it wasn't 19, I'm thinking about my birth date. In 2015, there was a whole range of changes in New South Wales government policy, where government was saying at the time, we can't look after children as well as local authorities or non-government organisations. So it was wanting non-government organisations to put its hand up and look after and provide foster care to children. And the government was transferring the care of that it had of children to non-government organisations. And at that point in time, an organisation called SSI, Settlement Services International, that had been working with migrant resource centres and settlement programs, put its hand up to develop an out-of-home care program and be an out-of-home care provider. Its experience had been very much with migrants in that migrant settlement period, and had been an advocate that the Australian government wasn't doing as much for multicultural parents. Multicultural parents were reporting that they didn't know where their children were placed when they came into care. They were raising concerns that their children were placed with carers who didn't share the same cultures as them, and that the children were losing their cultural connections. And I joined that organisation at that point in time. And we started off with an initial cohort of 30 children, which we had then grouped as Arabic speaking, Vietnamese speaking, and a breadth of other cultures. And we thought at the time that we were matching children. So we had Arabic speaking children placed with Arabic speaking carers, for example, and Vietnamese speaking children placed with Vietnamese speaking carers. And we were thinking that we were matching children. But what came up was that there were questions around some of the Arabic speaking children's placement, that their families' culture included a Catholic or a Christian faith. So they were Arabic speaking, but the children had been placed with an Arabic speaking carer who was of the Muslim faith, and this family and families were of the Christian faith. So we were questioning, was that placement meeting that child's cultural needs, and was it considered a cultural match when there were elements of culture that weren't aligned? So we were asking questions around ethnicity and around faith. And in some of the Vietnamese children's placement, many were being placed with older Vietnamese parent carers, some of them grandparents, but children's first language was English and the carers' first language was Vietnamese. So communication and cultural matching was not consistent, or was raising questions around, if children weren't able to speak their first language with their carers, was that an issue that we needed to consider? The other issue that kept coming up was we were talking about minority groups and refugees as being key factors that were influencing sort of how culture was being presented. So that refugee and migrant experience was raising questions to us around that settlement journey. So for many people who in Australia, their history in terms of their settlement is very, very different. There's people like myself who's second generation Greek and who have a whole range of cultural traditions that have been evolved over time that are slightly different to other, for example, Greek migrants who have just arrived and are holding their settlement, their connection to their community and their unfamiliarity with the Australian community in a different way than, say, somebody like myself who has had years of settlement in a community. So that settlement journey started raising questions for us also around what is culture and how important is culture for different people. And in that context, the settlement journey, ethnicity, language, and faith were elements that seemed to be present in terms of our conversations around culture. And what it prompted us to think about is really curiosity questions, not making assumptions about people, but using these 4 prompts to explore and be curious and finding out more from children and families around what these elements might mean to them, to allow us to be thinking about what does culture mean to them as in terms of children's biological families as well as carers. So some of the curiosity questions around settlement are thinking about, was the choice to come to Australia or the choice to live in the UK, was that one of choice, or was it forced? Whether it's for economic reasons or employment reasons, or as a refugee or as a migrant. asking those questions may give you information about this family that will allow you to think about what their expectations were and what that settlement journey was like. Are they first or subsequent generations? How close are they to hold to historical practices of the country that they've moved from? What was the settlement like before they arrived in the UK, in terms of whether it's a movement between a county or a movement from another country? What was their experience like before they moved and settled in the community that they're living with? And what's their experience like in the community that they're living with? Are they experiencing racism? Are they making connections with their neighborhoods? Are they making connections with friends? What's their experience and connections like in the local schools and so forth? So that settlement journey gives you a sense of how connected people might be in the local community, but also what their experiences were like that might be shaping their thinking. In terms of ethnicity, the questions are around exploring the ideas and what families might hold important to them. And this takes on board that point that even though we might share ethnic practices, we all practice it in different ways. So again, I'll use myself as an example. How I practice my Greek traditions may not be the same way as others of Greek heritage practice Greek traditions. Or what I think is important for my family may not be the same as what my parents' generation was, or what my children expect to be in terms of traditions around Easter celebrations or family celebrations. So what are the family heritage and what's the layers of ethnic history to this family, taking on board that many families have layers of different ethnic backgrounds. Parents can have more than one ethnic connection, to state the obvious. What are the countries? What's the history and connections with that country? If you're placing a child with a carer where there's been tensions between their country of origin, that may be an issue that you want to talk about. It may be resolvable, but calling it out and talking it through may be something that's worth considering. What are the traditions and the customs? There may be differences between places in countries. So what, for example, might be done in northern Greece as a tradition of the way we cook. A good example is, if anybody knows spanakopita, the spinach pie in northern Greece is cooked in a different way into southern Greece. So the way we cook foods or the way we practice certain traditions may be different in different parts of a country. The way people dress or the expectations of dress and behavior, the expectations of gender and family roles. And that's often another issue that becomes present with acculturation and through settlement journey. So it allows, the ethnicity lens allows us to ask questions around how is ethnicity presented or important to a child or to a family or to a carer. In terms of language, curiosity questions are around what's verbally spoken and what's not verbally spoken. What's the terminology that's used for different concepts? Is there a dialect difference? So while you can have Arabic speaking parents and carers, there may be nuances in the dialects and the terminology that's being used, and that can contribute to a communication challenge. So the fluency in English, the fluency in other language, the layer of education and the connection to language and what's preferred is the other element of culture that we realize warrants curiosity questions to help you understand what culture might mean for a particular child and family. And again, faith. What are the beliefs and views? How conservative, how practical, how adaptable are they? Are there significant milestones or events that warrant consideration? So collectively, those four elements allows us, or has been my experience, that it allows us to be thinking about culture and exploring what it means for individual children and families. The Churchill Fellowship. I'm just looking at the time, how I'm going. Okay. Um, so
Kathy,
the
you've got
Churchill,
loads of time. You're doing fine. It's great.
thanks, James. So the Churchill Fellowship, as I said, I went to the UK and I chose the UK. Sorry, I went to the States first, in Michigan and Seattle, because University of Washington was doing a whole lot of training, and has developed a whole range of curriculum training for its adoptive carers and its fostering programs. And it has developed that training for foster care and kinship care, as I said, that I was curious to explore. And the Casey Family Foundation was doing a whole range of work there. And I was also interested in coming to London to get my head across how the communities are dealing with the layers of demographic diversity that you have, that is more prevalent, I think, in numbers than what it is in Australia. So it took me to Scotland, to Ireland. And Ireland, I was particularly interested in some of the faith-based challenges around what's spoken and not spoken in the communities around different faiths, and children placed with carers who share different faiths. And Norway is also doing a whole range of research because they've had such an increase in the number of unaccompanied children and refugees coming to them. And I think for me, three key comments came out from all of my conversations, and that's leaning into and exploring culture. If we are intentional in terms of giving value to culture, if you are curious to ask questions and trying to understand what culture might mean for an individual child and family, and then you are willing to be reflective of your own biases, your own thoughts, and your own attitudes, those three key concepts for me really resonated in terms of good practice, being intentional to give priority to culture as part of a child's well-being, being curious and being reflective. Oops, I'll go back. The Churchill report's available online. If you type in my name and the Churchill report there, I interviewed, I think about 45 people and wrote up around 14 different feedback. And I know that's really small print there in that sense. But I collated an A to Z, I guess, as a practice prompt that I found helpful as a guide to be thinking about what can guide us to be intentional, curious, and reflective. And I'll use the abbreviated version, but some of the things include like being an advocate to build practice evidence. What is the practice that people are using in your team, in your local authority, in your county? Where is the evidence that cultural connections have been achieved for children? And do you have that practice evidence? Can you be an advocate to ask for that practice evidence and the examples of where culture is being connected? Is one prompt. Being intentional, being curious, and being respectful is another prompt. Having conversations and seeking connections. So the concept of keeping children connected to their family, to their community, and to their culture is really critical. What can you do to contribute to those conversations around those connections and those relationships for children? For me, data is really important. So what is the data that you are collecting in your organization around children's cultures? Do you have that information around children's settlement journey or family settlement journey? Do you have information about children's parents' ethnicities? Do you have information around their faith and their language? Are you able to collect data? Because data collection matters. It gives us a lens. It focuses on culture. Where is the evidence of monitoring practice? So in what organizations, in what teams are you actually monitoring not only placement stability and long-term care and children's school progress and children's healthcare needs and their relationships with their family? Are we actually collecting data and the evidence that's monitoring children's practices and cultural practices? Oops. Faulty assumptions evolve when we keep inaccurate information. We make assumptions around children's cultures. We then respond to those cultures. We haven't checked those assumptions. Somebody looked a particular way. We thought that they were Muslim. We thought that they were Arabic speaking. We thought that they followed the Buddhists. She looked Lebanese. Those faulty assumptions, without checking, can have a really significant outcome, a negative outcome on children. In one example, Keris talked about in the upholding research that I'll talk about in a minute. Keris talked about they were told the child was Russian, so they did all this homework to understand the Russian culture and found community people to be connected to that were interested in connecting this child to his Russian heritage, and then it was found out that that wasn't the case at all. He didn't have that culture. It was an error in judgment, in information that carers had then responded to without double checking. A greatest gift a practitioner can give a child is the way a record is written. The way we talk about a child, the way we write about the child and their family and their culture is one of the greatest gifts a practitioner or a social worker can give a child, with some of the other messages that came through for the advocates from the Churchill research. It's hard to develop trust when a child's constantly in a survival mode. So develop culture is about developing relationships. To develop relationships, you want to develop trust. It's hard to develop that relationship and that trust if you're in a crisis mode. If we don't give voice to culture, are we devaluing it? So if we as practitioners don't raise it, I mean, the fact that you're here today obviously is saying that you are interested and you want to give voice to it, and validating that giving voice is an important part of the way we care and respond to children. You can't do it on your own. Joint partnerships are really key to part of cultural connections. And that's about either bridging a partnership with the child's family to learn about their culture. It might be bridging a partnership in relation to one of the earlier questions. Do you know where to go to ask questions and to connect this child to their culture? Finding those partnerships really can strengthen the way you work and respond to a child's culture. Checking out information with knowledge holders. And when we talk about knowledge holders, it's a terminology we've been using in Australia, but it came up in the Churchill research. Knowledge holders can be the child, it can be parents, it can be extended family, it could be colleagues. It's seeking out the voice of people with lived experience who hold the knowledge of what cultural experiences and practices can be. It might be the mosque, it might be a temple. It is people who have that cultural experience, and it's using them as a sounding board to learn more. Being a language warrior was a strong point that Indigenous Indian advocates raised. The way we talk, the way we use our terminology, the way we use our language, and the way we approach culture can create language warriors. As practitioners, we can be those language warriors to give voice to children's cultural, individual cultural profiles and what's important to them. Muting conversations about culture devalues its importance. So if we don't talk about it and we mute it, then we're not valuing it. And again, that's one of the key messages around talking to key people who are involved in a child's life. And this point for me was one of the important ones. No matter what is happening to a child, being disconnected by being in out-of-home care, being disconnected to their culture should never be an outcome of their experience of being in foster care or kinship care. Organisations need to protect their social workers and look after their social workers so that the social workers can look after children. And that's about giving practitioners time, giving practitioners access to resources, to reflect, to learn, to develop skills. Culture can be a protective factor. We take that for granted in that sense. So knowing how to connect to your culture for many children can be a protective factor, something that keeps them safe, something that gives them a routine, something that gives them a connection to a sense of belonging. Asking questions again can help explore both conscious and unconscious biases. The curiosity questions, I cannot underscore how important being curious and asking questions and checking those assumptions. You might be right and you might be on the mark with what you're thinking. Asking those questions and checking them out and having that conversation can only enhance and validate your approach. Relationships are the golden threads of culture. Building those relationships are not just only with biological parents or siblings or aunties and uncles, but building relationships through a child's community. Strong advocates can really embed and strengthen safeguards for children. If we advocate for culture, it's not just a compliance issue, it's a safeguard issue. It's building those protective factors, it's building relationships, it's building connections. Training is essential to support and reflect and learn. And a credit to Karam and to everybody here for taking the time to be doing this. Unique sounds are heard through culture. So children's individual identity and their uniqueness comes through their connection to their culture. Valuing cultural connections values relationships and values collaborations. Again, going to that point in partnership. What is called culture is relational actions that support connectedness. Who and what the child is exposed to matters. So giving children the opportunity to hear music, to listen to language, to be exposed and to be living or to see other people who look like them can help them build their sense of understanding of where they might belong. One of the questions that and comments that another colleague made during the Churchill research, which I find really interesting, is, are you thinking of a child's culture today or their future self? So in the environment, in the foster care and kinship care of that crisis and that urgency, or with young children where we might be thinking culture doesn't matter, children are disconnected from their birth parents, or they're not connected to their sense of cultural identity now. We know again and again that children will be curious as they move into their adolescent years and into adult years and ask questions about their sense of belonging and their history and their well-being. So are we thinking about the child that we are caring for today, as well as that their future self, who will want to know or is likely to want to know about their culture and their heritage? And zeroing in on culture helps children thrive, not just survive in care. So as I said, the full report and some prompts are in the Churchill report. And there's an ABC that also targets practitioners, team members, and executives. But certainly I found that these practice prompts can really resonate in and some things being more important to individuals than others, but collectively it is around the evidence, the data, the relationships, the curiosity question, and valuing culture for today and for today's child, but also for the child that they're going to be in years to come. It's me. So the upholding children's care, cultural connections is, as I said, a 3-year research, and the model is being designed now. We're looking at the practice messages for practitioners and for children, for birth parents and for carers. There's a number of papers that have been published, and again, I'm very happy to give you the link for that. Practitioners were very much talking about they want to be able to know where to go to get advice on different cultures, who can be their sounding board. They again and again talked about making time to check out their own views and being able to reflect in a safe environment their thinking about different cultures so that they can hear from their peers different ways to approach assumptions that might be made in the information gathering and the assessment mode. So those communities of practice and the opportunity to reflect practice was something that came up from practitioners again and again, as well as the need for more information to check the data that we've got and giving voice to the element of culture being part of children's well-being. Carers really talked about struggling with this concept of authenticity. Can a carer who doesn't share a child's culture be in a position to authentically nurture a child and facilitate the experiences that they may have had if they were living with somebody who shared the same culture? Was one key element that came up from carers. Sorry. Excuse me, that was coming up. And other carers really talked about putting themselves out there and going in and meeting representatives of the children's community by taking the child and going to their community, to the child's community, and embracing the community and building cultural mentors for them. So the concept of for carers were very much messages around, I need to put myself out there to embrace my child's culture and include their routine into our life. So they talked a lot about, some carers really talked about using music and nursery rhymes for young children where their culture was different to theirs as a way of exposing the child to language and to the sounds of their culture. Other carers really wanted to know, who can I go to in the community to be a mentor, who's a mentor, who can give me advice? And other carers were really struggling with this concept of, it's not my role to be a cultural mentor or a cultural link. It's the role of birth family to do that during family visits. So there were some diverse views in carers in that sense. For parents really expressed some foundational messages around feeling powerless, feeling helpless, and this strong sense of grief of not being able to care for their children. And on top of that, there was a strong sense of real disappointment and struggles with seeing their child lose cultural practices that they had established when the children were living with them, that were being diluted or lost in the care environment. And that was a strong sense of frustration for and concern for many birth parents. And the other huge challenge that they talked about was how to redefine their role as a parent. I'm not looking after my child on a full-time basis. The child's living with another carer. How can that person be mum and I can be mum? But how can I also be a parent when I'm not raising this child or seeing this child regularly, and I'm seeing the child, irregularly or at certain times? And how could that culture? How could I use that time to share storytelling and sharing language and cultural practices and cultural information with my child. And that's probably one of the strengths for parents, is really being an advocate to find support for them to be able to adjust to their role of being a parent to a child who is not parenting a child in a traditional, in full-time concept, and being able to share stories and cultural experiences and cultural activities. So a lot of that opportunities to do that in family visits was something that came up as a recommendation from birth parents. Children, the older children, not surprisingly, in their late teens, talked very much around the value of cultural connection and wanting to reconnect with their community and culture as they were moving into the late teens, and talked about reflecting when they were younger and thinking it wasn't important for them. So as developmentally, children were saying, when I was 10, when I was 11, when I was 12, it didn't matter to me. I didn't want to be connected to my family and my culture. When I was 17, 18, 19 and beyond, cultural connections, knowing my family, knowing my community and reconnecting to my tribe and those practices was really important. It was interesting, when I was in in London, I went to the Orthodox Church there because I was really curious to see it and compare it to the Australian community. There's Orthodox cultures, and at the end of and I was really surprised at the diversity of ethnic Orthodox people in the Paddington Church, and which is not as similar in my experiences here in Australia. And at the end of the service, I found myself asking questions to these two young men in front of me, and one was dark skinned and the other one was really fair skinned. And I said to him, you know, what brought you here? And he said, one of them said to me, my grandparents were Russian Orthodox, my parents were atheists, and now I'm reconnecting with my Orthodox faith and my Orthodox culture. So even though he wasn't necessarily in care, but it represented this reconnection to culture that can get lost through generations when and that young people in their early 20s can really be interested in reconnecting with aspects of their culture. It was just another validating point for me at that time. As I said, the upholding model is we're just consulting with a steering committee, and that will really filter through a whole lot of practice principles around being reflexive, about being real, being respectful, being relational, and it looks at 4 key elements of community, culture, care, and being child-centered. And includes a breadth of curiosity questions, a breadth of training options, and a breadth of organisational assessments that can be done to measure the current practices around cultural connections. And obviously we'll be happy to share that when that's released. And I guess in terms of my current work now, I'm also looking at doing at my research, and I'm really looking at those organizational levers. How do organizational executives and teams support practitioners, and what is the oversight monitoring in organizations around decisions that give priority to counting culture, to valuing culture? So how is executive decisions allocating resources and saying, we are interested in children's culture, we are interested in monitoring cultural practices, we want to know how social workers are addressing children's cultural practices, and we want to be able to monitor that. And I'm interested to see how is training nurtured for staff and for carers. What is the level of collaboration with cultural knowledge holders, and what's the practice evidence that executives and team managers in particular give value to, so that those environments and those levers can support the practitioners do this sort of use the self tool and use the practice of conversations with families. Because if the environment across the organization isn't there to support practitioners, I think the ask is really huge. So that's in the early stages of research, and I'll be using a case study with much promise, I think, around looking at sort of the levers. Some of them are in the ABC prompts in the Churchill report. And so this research, industry research, will be really looking at the evidence to support that. And I think it's condensed